So this morning we received, which we expected, a presumptive positive test for COVID-19 that's going to be confirmed by the CDC. And it is the sister of the young female who traveled back from Italy. She was also traveling back. She has been in isolation since this was all identified. And again, that was something that was contemplated. There is a roommate in addition to the sister who is in isolation, has not been symptomatic yet, but obviously that's something that's monitored. In terms of the gentleman who is in Sarasota, he was in contact with a number of healthcare professionals. You have some that have been determined medium to / high risk of transmission, others low. There are 4 tests currently outstanding, so we've not received the positive yet. But obviously, once we get those information, we will. I was on a conference call this morning with a bunch of healthcare professionals, including the nursing home community. If you look at COVID-19, Dr. Fauci and CDC director put out an op-ed in the New England Journal of Medicine this weekend, and they cited the first kind of study that's been done with the China population. And in that study, there was not anybody who had tested positive who was 15 or under. Now, that doesn't mean they can't get it, but that suggests that perhaps they're resistant to it if you're younger, or perhaps the symptoms are so mild that they're not even registering. But that study also showed that people with underlying symptoms and elderly are most likely to have the severe cases. And so, we've been issuing guidance to the nursing home community, assisted living facilities. You should not be having people entering those facilities who are exhibiting any types of symptoms. And you really need to be, I think, forward-leaning on that. We've seen what's happened in Washington State. So we're going to continue to work with them, but we obviously believe, our elderly population would be more vulnerable than the rest of the population at this point, so we want to take action.